name is Dr. Jill Copley, and I'm an audiologist and own Total Hearing Care. We have 5 locations, kind of in almost along 75. Our closest one to this office is going to be in Plano, but I'm not here to talk about that. We are here to talk about balance, and we have a huge group. So I want to make sure that Dr. Carter and I are able to hopefully answer your questions you might have today, because there's obviously, for most of you, a reason that you actually came out in this heat to come sit here in more heat to listen to us. So if anybody would be brave enough to kind of let me know why you came or what you are wanting to get out of this presentation. Okay, let me start here.
I wear a hearing aid. I was talking to Dr. Carter, and unfortunately, I buy the best quality hearing aid, but it seems like my hearing is going down, so that doesn't work.
Okay,
So
she bought hearing aids, but her hearing still seems to go down. We're not going to be talking about hearing aids too much tonight. Whole different presentation, but certainly you can talk to us after. Okay, and there was somebody, somebody back there that had raised their hand.
Did you have a question?
Oh, hi.
Hi.
Yeah, I came for balance and interested on what some of the paperwork said about the connection of hearing and balance. And I feel like I hear really well. And there was something else and I distracted myself and I can't remember.
It's okay. So she came for hearing and balance. Anybody else? Yes, ma'am.
I have tinnitus.
Okay, so she has tinnitus.
Little raining.
Okay. Okay.
Me too, tinnitus.
Tinnitus.
Only 1 year.
Can you settle the debate?
Yeah.
And this may be a tomato thing. Is it tinnitus or tinnitus?
It's either tinnitus or tinnitus.
Whichever you prefer.
Yes, whichever you prefer. Okay. Well, let me tell you what an audiologist does. First of all, where do we fit into medicine? So, audiologists are specialists that focus on hearing evaluations, treatment of hearing loss and tinnitus, as long as there's not a medical condition that could, fix those issues, such as surgery or medication or something. And then we are able to activate and program cochlear implants. And we are also a field that does balanced diagnostic testing. So those are kind of the 4 things I think of. There's some other little things in there, but that's basically what we do. Now, as I started to put this presentation together, I went to my husband and I said, gosh, this is so serious. Balance is so serious. This system, the balance system, is so complex. How can I try to make this fun, or at least the first slide fun? And he goes, why don't you have someone on a high wire walking across? And I looked at pictures and I said, how about a dinosaur in a pink tutu on a high wire? And that's where this picture came from. But, and I think a lot of what we talk about will really blend with what OsteoStrong does here, as far as looking at your balance, your strength, because we're going to talk about that. But first of all, I want to give you the real reason balance is so important. Injuries from falls are the #1 leading cause of injury-related deaths in those 65 and older. Okay, so it is a very serious topic. Once you fall, you're twice as likely to fall again within the next year. Falls in those over 65 years old often result in hospitalization, and falls cost billions of dollars in healthcare expenses in the U.S. Now, how does this kind of relate to hearing? People with even a mild hearing loss are 3 times more likely to fall than those with no hearing loss. And as Deb was mentioning, she can tell when you have hearing loss because your balance is off. Every additional 10 dB, which means your hearing's getting worse, increases your risk of falls by 140%. So the worse your hearing, the higher your risk of falls. And that's what we're trying to prevent here. And so I'm going to turn this over to Dr. Carter, who's going to talk about the nuts and bolts of balance, hearing, vision, proprioception. And then at the end, we will ask and answer any questions to the best of our abilities. We also have gift bags on the table. Yes, I've got models back there at the table in the back. And if you decide this is really important and you need your hearing checked, we do have blocks of appointments available that you can sign up for. Okay, so Dr. Carter, if you can slide in here. And this is the balance system. This is how complex it is.
Thank you. All right. Can you hear me okay?
Yeah.
Hi everyone, I'm so glad you're here. So we're going to talk just about a lot of okay, louder, better. Okay.
Closer.
Closer?
Yeah.
Okay.
It's when the AC comes on back here.
Okay.
That makes it harder.
All right, thank you. I appreciate that. So this graphic, I'm going to talk through it for those who cannot see it well, shows just the different systems that all play into our balance. It's not just one thing, it's multiple systems working together. And the more of those systems are intact and functioning well, the better our balance outcomes are likely to be. So we have the inner ear vestibular system. So that's a part of the inner ear that is more tuned to balance than necessarily the hearing detection. The eye, visual system. Proprioception, which is just the location of your body in space and how we sense that. That gets into postural control, and eye movements are also involved in this. So this is dense. Here we go. We're going to simplify it and break it into 4 parts. Ear, proprioception, vision, and the brain, central nervous system. Let's start with the ear. We like the ear. Specifically, we are looking at the vestibular system. The inner ear has got this round circular organ called the cochlea that is tuned to detection of sound, and impairment there can lead to loss of hearing. But then you have this other part that's got these hoops, and that's the vestibular system with those semicircular canals. This senses rotational head movement, such as nodding yes, no, but also as we tilt down and lean back up, are we getting that signal accurately? The nerve that connects from the vestibular system goes to the brain. So it stabilizes your vision while you're moving. As we turn, our eyes either turn or don't with it, and it helps us know where we are in space. And if one of these canals is damaged, impaired, you can feel off balance or dizzy, and that experience is called vertigo. Vertigo is a very specific, dramatic experience of imbalance that usually hits in a spell. We'll talk a little more about that. There are several different disorders that can cause vertigo. One that comes to mind prominently in our field is Meniere's disease. Have you all heard of Meniere's disease?
Yeah.
Okay, kind of mixed. Meniere's presents in episodes of vertigo, feeling like you are spinning, that can also involve a fluctuation of hearing, so feeling like you get the spins and your hearing drops. It will result in a loud kind of tinnitus, or tinnitus, both are right, that usually sounds loud and low. And there is also this feeling of pressure in the ear that comes with that. Fluid is building up in this ear system. You can see it illustrated right here. And this will fluctuate over time, and you will have times when your hearing is good, and then you will have other times where your hearing drops. As audiologists, when we're managing a patient who has Meniere's disease, we're often looking at programming hearing aids in a way that goes up and down to follow that hearing as it changes. So other conditions, labyrinthitis, inflamed nerve. Anytime there's an itis, we're usually thinking inflammation. So an inflamed nerve of the labyrinth of a semicircular canal caused by a viral or bacterial infection usually strikes one ear, but it can happen to both. And another thing that can cause imbalance is ototoxicity, and that means medication that has caused damage to the ear system and is potentially making you dizzy or even lose your hearing. Okay, so here are some that affect the vestibular system only. Benign paroxysmal positional vertigo, BPPV, is actually pretty common. And what happens is calcium crystals of the ear get lodged in the wrong spot and they just trigger a dizzy episode. A lot of times people will experience that when they lay back, lean up, and it only hits in a situation like that. Another one, vestibular neuritis, inflammation of the vestibular nerve causing vertigo, nausea and imbalance. Ototoxicity again, the mycins, gentamicins, streptomycins, IV antibiotics and platinum-based chemotherapy agents can also cause vertigo and hearing loss. Okay, so let's go through some of these diseases and what the treatment might be. For Meniere's, often prescribed would be diuretics to help with fluid, medication to help with vertigo that should be taken when that vertigo is present and not when it's not. And then we want to treat the hearing loss to help with balance. Labyrinthitis, also looking at medication to treat the inflammation, steroids, antivirals, and again, treating the hearing loss. BPPV, that one where I was talking about lying back, leaning forward, and getting dizzy, you actually want repositioning treatment. So this can be performed by an audiologist who specializes in balance, and they'll do a specific maneuver called the Epley maneuver to reposition you and reset those calcium crystals, put them back where they're supposed to be. Vestibular neuritis, usually prescribed steroids, and again, medication to treat vertigo when it occurs, nausea. Other kinds of positional vertigo can be treated with vestibular therapy, which is similar in some ways to physical therapy. It's training your brain to respond appropriately to how you are moving in space. So there are different professionals who can do vestibular therapy, but usually we're looking at that after a vestibular condition has been diagnosed. As for ototoxicity, if this arises, this is a hard conversation with the doctor, because sometimes when you're taking some of these more heavy-hitting medications, it's because there's a serious problem that needs to be managed. So sometimes for our folks who are following chemotherapy treatment, they will be tested for hearing imbalance alongside their cancer treatment, and we're seeing if hearing starts to drop or if dizziness starts to occur, do we need to tweak the medication? And these are just some of those hard decisions that are made between patients and their doctors. Okay, talked a little bit about this. Vestibular therapy is a special thing, but it's designed to treat dizziness, vertigo, and balance disorders. Targets the vestibular system in the inner ear and its connection with the brain and eyes. So this is brain training, really. It's kind of like a physical therapy brain training mix to help make sure that you are responding appropriately to what you're seeing and how you're moving, so that you better know where you are in space. Visual system, the eyes. So our eyes help us see where we are in space, and they help with depth perception, but also, motion, speed, all of these things that we can see. I mentioned this a little bit earlier, but these four systems, the ears, the eyes, proprioception, central nervous system, if one of these systems goes down, then we have to rely more on the other systems. If two of those systems go down, now we're putting a lot of work on the other parts of our body that help us know where we are in balance in space. So these vision disorders can impact the likelihood that you'll have a fall. Cataracts, macular degeneration, glaucoma, diabetic retinopathy, and retinal detachment. Proprioception is senses in the muscles, tendons, and joints that tell your brain and your body parts where you are without you needing to look at them. It's just your orientation, feeling right, your equilibrium sense. It has to do with your posture. An example is your feet can feel the ground. Walking up the stairs without needing to look at your feet would be an example of strong proprioception. And also knowing where you are in the dark, that's an example of one of those senses being deprived. Now you're relying more on your proprioception, and you want a strong inner ear system to make sure that you're not going to get really dizzy when someone turns off the lights. These are some disorders that can affect your balance. Neurological, stroke, multiple sclerosis, injuries to the body, B12 deficiency, a vitamin deficiency, dehydration. Has anyone ever felt a little thirsty and a little dizzy? Arthritis, Parkinson's disease, ALS, and autism spectrum disorders. Okay. And so symptoms of these problems might be balance and coordination issues, frequent falling or staggering, spatial awareness deficits, bumping into things, missing steps, and watching your feet while you're walking. Ataxia, which is a loss of full control over body movement, and motor control issues, difficulty writing or buttoning your shirt. So treatments for these kinds of problems would involve physical and occupational therapy, treatment of the disease process, surgery, so knee hip replacements to help you, better strengthen your proprioception, and balance exercises. Things like Tai Chi and yoga are low impact ways that you can improve your ability to have strong orientation in space, and strength and resistance training. Lastly, our central nervous system. So it receives input from the inner ear, visual and proprioceptive systems to coordinate your balance. Make sure all of those messages are lining up. The cerebellum is the part of the brain that is important. Muscle coordination and posture control are located in that center of the brain. The brain stem is going to be responsible for automatic balance, reflexes, and all of those very basic things that our body does without us having to think about it. Your cerebral cortex, which is your motor planning and movement and spatial orientation. Some diseases that can affect the central nervous system and affect your balance: multiple sclerosis, Parkinson's disease, which can cause a slow reaction and problems with gait and balance. Cerebellar ataxia, which is a direct injury to the cerebellum causing jerky movements. Cerebellum is at the very, very back. And this one, which is interesting, mild debarkment syndrome. So I learned more about this in putting the presentation together. This is feeling like you are seasick or motion sick, and you feel better with movement rather than being still. So if you go on a plane or a boat and you feel bobbly and wobbly there, you get off and you still feel that way, even for a long time after. That is a problem with the central nervous system. We've got some mixed messages going on. Okay, and it usually occurs after a long boat, plane, or car trip, and you feel better when you are moving versus when you are being still. Symptoms at least 48 hours to months long. And treatment could include vestibular therapy and is sometimes helped by going on a long trip again. This is fascinating to me. Yes.
It's motivation to get back on your boat.
Yes, it absolutely is. I agree with this.
Those words, mild
Débarquement
is French for illness of getting off.
That's what I thought.
Yeah.
I thought it was illness of disembarking. Yes. This is a fascinating one to me. So whenever systems go down, it increases the likelihood of fall, because as you've probably gathered, there are a lot of things that need to work together well in order for us to have good and comfortable balance. So if you lose your vision, or the vision system is impaired, you must rely more heavily on the other systems, your proprioception, your ear, your central nervous system. Well, what happens if you have hearing loss and vision loss? That's not uncommon for people to experience both of those things. And many of the diseases that affect the central nervous system and our proprioception are not uncommon either. So it's often, while there are these diseases that create violent vertigo attacks, more often than not what I see is people who are having a little bit of problem with one thing, a medication that may be affecting their balance, and some hearing loss also. And all of those things play together to make it more likely that you could fall and get hurt. Diabetes. Folks who have diabetes are 60% more likely to fall than those who do not have it. Are 2 times more likely to have hearing loss and reduced spatial awareness. Diabetic neuropathy, so lack of feeling in parts of our body, can make it harder to find your orientation in space. Peripheral neuropathy, loss of feeling in the feet, trouble potentially tripping. Here's an example of something that's affecting multiple systems of the body that are all involved in balance. Medication can cause changes in central processing. Strokes. Up to 73% of people fall within the first year after a stroke. It will create, potentially, vision issues, difficulties with auditory processing, which is to say, the more brain-oriented processes involved in hearing. There is the detection piece, which is, can you hear it? But then there's also, what is the brain doing with that? And lots of parts and pieces need to line up to make sure those processes are working as they should be. A stroke affects the central nervous system, can include problems with thinking, memory, and spatial awareness, can also cause weakness in the muscle and paralysis. So treatments for stroke include physical therapy, specialized exercises, occupational therapy, and speech therapy. How is dementia related? So, hearing loss is the #1 modifiable risk factor for dementia. What that means is this is a risk factor that you can treat, or with the help of an audiologist, we can rehabilitate this problem and make it less likely that you will suffer cognitive decline. Vision loss is another modifiable risk factor. Dual sensory impairment, hearing and vision loss, increases Alzheimer's risk by 46%. Diabetes is a modifiable risk factor for dementia, so managing diabetes if you have that problem. And poor results on gait speed, step length, and single leg support increases risk for mild cognitive impairment and dementia.
What was that last one?
Poor results on gait speed, so how fast you're walking. But also step length. You know, are you walking an appropriate length? Are we shuffling or taking small steps? Single leg support. Can you do this? Those are signs, if you're struggling with those things, that you could be at greater risk of cognitive decline. So hearing loss and poor physical performance are both linked to cerebral and cortical atrophy, so parts of your brain shrinking, and cognitive load. So the brain is working too hard to hear or perform physical tasks. So when we rehabilitate these problems, your brain doesn't have to work as hard for you to process the sound, process the visual input. You are giving your brain the support it needs so that it can focus on other things, like maybe where you are in space. Here's some imaging that shows what hearing loss looks like relative to normal hearing right next to it. You can just see that we're lighting up more centers of the brain when hearing is normal, and that's because hearing doesn't just exist in one spot in the brain. There are lots of pathways that are stimulated when you hear well. what can you do to reduce your risk of falls and dementia? So use your hearing aids if you have them. If you are having trouble with them, go see the person who you got them from and talk to them about that. Treatment is about 90% effective for most vision losses, including glasses, but removal of cataracts can eliminate dementia risk. Successful treatment of diabetes includes insulin control, exercise, and diet. Okay, and don't be sedentary to the best of your ability. Try to keep moving. Physical and vestibular therapy for those who are good candidates for such. And you may need medication or surgery for some of these problems. Thank you. Does anybody have any questions?
I do.
Sure, yes.
So tinnitus, right?
Tinnitus.
You've got, the kind that is just kind of a steady background annoying noise,
Uh-huh,
and then the version that pulses with your heartbeat,
yes.
right? What,
Pulsatile tinnitus.
Yes, which responds better to treatment and which is more resistant?
Okay, so when somebody tells me, and Dr. Copley, feel free to jump on in here at any moment. When the question was about tinnitus, ringing in the ears, steady state versus pulsatile tinnitus. Pulsatile tinnitus is tinnitus that follows your heartbeat. So if it feels like it's going up and down with the with your heart rate, that can be a sign of a medical problem that needs to be managed. So anytime someone tells me that they're experiencing pulsatile tinnitus, I'm going to ask that they consult with an ENT physician to potentially get some imaging and just make sure that everything's okay. I would say that tinnitus that can be managed in a medical way is usually well managed with hearing aids. About 80% of people who have bothersome tinnitus find that amplification is a helpful intervention. Most people who have ringing in the ears, tinnitus, can also present as roaring, buzzing, crickets, locusts. It can sound like lots of things. Do have some hearing loss present. So usually we want to evaluate that side of it and then talk about what's next. But I think both can be well managed with amplification.
Pulsatile tinnitus, however, may not be as well treated with hearing instruments because it's typically coming from blood flow issues from the heart vascular system, and so that really has to be treated by a physician to confirm you're not having vascular issues, stroke kind of problems. So have you had somebody with pulsatile tinnitus that worked well?
Who proceeded with hearing aids? One, but both were medical referrals.
Yeah, those are harder.
Yeah,
Those
yeah.
are harder. Yeah. The other noises in your head, we can treat pretty successfully. Some of them.
Any other questions? Yes.
Yeah, so when I was 18, I had a stroke and I went to the doctor a while back and they said that the stroke affected my balance. So does that mean I can still fix my balance or I'm just stuck with, because my balance is terrible.
What she's asking, in case anyone didn't hear about it, is she had a stroke that affected her balance, and the question is, are we stuck, or is there something that can be done? There is something that can be done. So remember how I was telling you that there are multiple systems that affect your ability to keep good balance? If one of those systems is impaired, then you want to think about, or your therapist, vestibular therapist, physical therapist, would want to think about strengthening those other systems to give you the best likelihood of maintaining good balance, even though one system is down. So we want to make sure that your other problems are well managed, or that you're not having as many problems in other areas.
And then I have another one.
Oh, let me add on to that. When I was working on this, I found a research article that talked about proprioception and balance. And the three things, I believe it was three things that can help long-term are strengthening exercises, yoga, and Tai Chi.
Tai Chi.
Yeah, those were the three that they mentioned. They had some other things that didn't really correlate, but those did.
Okay.
But you have to keep up with it.
Yeah,
You know, when
have
you've
to
had
be
a stroke,
consistent.
there's some damage there in the brain.
Yeah. Tai Chi.
Yeah, so you're really trying to strengthen.
And then another thing that I only have like one eye, so I don't know if that has anything to do with it. I think it do though.
Well, like she said, you have your vision and your proprioception is off.
Yeah.
Anybody else have a question? Yes.
What causes a person to have great pressure between their ears? Is it that a system is off or coupled? Like what causes like strong pressure between your ears?
Teenagers.
I was gonna say stress. You said teenagers.
Yeah, I don't have any of those quite yet. But someday. So a couple of things come to mind. They aren't necessarily ear related off the top of my head, though sometimes feelings of pressure in your ears can be uncomfortable in your head, and sometimes my patients have allergies that's affecting head, eyes, like we're stuffy here, and also our ears are a little bit stuffy. And then I'm thinking also about other things such as stress or maybe even migraines. I think there's so many things that could cause that sensation. Certainly some ear systems could contribute, but it feels like it might be a little bit different. Dr. Copley, do you have anything to add?
Usually when it relates to the ears per se, you're gonna feel that pressure in the middle ear, the inner ear. It's not gonna be necessarily in your head. It's gonna be, it's gonna be localized. If it's ear related, like an ear infection, fluid, Meniere's, things like that. And you're gonna feel really off balance if you have either of those. You're gonna maybe be dizzy. You're gonna know something's going on. You're gonna feel it in the ear versus the head.
Yes.
This is a crazy question. What's the best way to keep your ears clean? Are Q-tips bad? You hear all these.
That's not a crazy question. What's the best way to keep your ears clean, and are Q-tips bad? The best way to keep, this is a simple answer and a complicated answer, so I'm gonna lead with the simple one. You do not necessarily need to, for most people, go in and do anything to keep your ears clean. I know all of our mothers taught us to use Q-tips. If you look in teeny tiny fine print on the side of that Q-tip box, it says, don't put it in your ear. They know their market. You can rinse your ears out in the shower. There are some drops you can get over the counter. A popular one is Deep Rocks if you are concerned about wax. But if you feel like your ears are getting dirty or plugged, I would talk to your primary care physician or come see an audiologist. We can look in your ear and tell you if a wax buildup is starting to occur. And we can talk to you about what the best way to treat that might be, including potentially removing it in the office with flushing it with water or grabbing it with a little scoop. But I do not recommend that you do any of this yourself. You can't see inside your ear, and I know I have, and you probably have too, seen somebody who's gotten a little too aggressive with a Q-tip, key, safety pin, etc. So even if your ears feel itchy, I would just have someone take a look.
I once had a lady that had like 2 Q-tip heads in her ear, and wax had built up around it. I don't know how she didn't feel the first one before she came in, but she had like 2 of them had to remove.
And then they said when you use Q-tips, you just really pushing the wax down in your ear even
Correct.
further.
I like the analogy of those old cannons that you had to push the gunpowder in. You're kind of doing that with, and inevitably some of it's coming out on the Q-tip too. But this advice extends to ear candles. They're also not recommended.
Why? Why?
Because they don't actually do, they can't generate the pressure that's needed to truly vacuum wax out of the ear. They can create a change in the pressure and the feel of the ear that can make it feel like your ear is getting clearer. But you can be very injured by that wax getting too hot and getting into the ear canal, and we just don't want fire that close to our faces.
And after somebody's used ear candling, when we look in the ear, it looks like there's like ash in your ear that's stood in your ear. So that's not supposed to be in your ear.
Sorry, everyone. I feel like I burst some bubbles there. Yes.
How about POTS? Is that related to the ears too? When I work night shift, I feel like when I get out.
Oh, did you say POTS?
Yes. Yes.
I'm not familiar with that diagnosis, are you? No, I'm sorry I can't speak to it, but certainly fatigue can affect all sorts of central nervous processing.
Like a vertigo symptom.
Yeah, certainly. I mean, they say that people who drive, who have been awake for too many hours, operate as though they're impaired. So, you know, so many of these systems are all connected together in that way. Unfortunately, I just don't know anything about that particular process. Yes, sir.
How can you maintain good health for your calcium crystals?
Ooh, that's a good question.
What?
How do you maintain good health for the calcium crystals in your ear? So I know we want to avoid head trauma. Generally, I've seen a few people who started to experience vertigo and problems like this after being hit or hurt. So, you know, to the extent that you can, maybe no boxing, right? But yeah, avoid car accidents if possible. I will say, and this is less to do with calcium crystals, but for some of these things like Meniere's disease, what's often prescribed in addition to medications and treating the hearing loss is a low salt diet, because it can affect the potassium balance in that inner ear system, and it can help reduce inflammation. But as far as what can keep those processes healthy, I can't think of anything off the top of my mind. I do notice that there tends to be some family. Sometimes these things run in families. So maybe dad had trouble with BPPV and son does too.
Yeah, there's not one specific thing. I think accidents, head trauma, traumatic brain injury, those kinds of things if you hit your head, but sometimes they just happen. And BPPV is the easiest one to treat, which is nice. Takes just a couple of minutes.
So these crystals, right, they get loose and cause mischief, and then all of a sudden your world's spinning, right? That's when they get into mischief. Well, do they have a useful purpose? Like,
Yes.
what are they in there they're supposed to be doing?
Yeah, so what are the crystals supposed to be doing? They are a weight system. And so they're on little nerve cells, and as you move, those crystals move with you. And so they help with your balance. But if they get dislodged and they move to a different semicircular canal or to the end of one, then they have to be put back into place. Or you'll have, and the dizziness with this is not very long. You know, it's usually less than a minute. So it's not something you'd use medication for, that you'd use those special vestibular procedures. And like she said, they can be done. Our office is not equipped to do that. But I used to work at a place where I did those all the time. ENTs can often do them. Physical therapists can do them, that kind of thing.
How can you put them back in place?
You're rotating your head. You're rotating your head a certain way to get those crystals back in the semicircular canal that they go into. Those semicircular canals are they're made of nerve cells, fluids, those kinds of things.
Crystals.
And crystals.
Oh, lots of questions.
My mother-in-law and my brother-in-law both had periods of debilitating dizziness, and they started taking ginkgo biloba and ginger, and they don't have it anymore. Have y'all ever heard of that?
No, but I can speak to maybe some of the relationship between supplements and other hearing problems, which is to say, there is not a lot of strong, high quality research supporting their use for this purpose. That said, sometimes people do, report that they've had good outcomes on things like this. I would say with any supplement regimen, even if it does feel like it's something easy to obtain over the counter, I would talk to your primary care physician and make sure that it's got safe interaction with other medications you take before trying it. Yes.
I just was wondering, like, when you feel like you're having motion sickness or dizziness like that, and you get that over the counter, what does that do?
Oh, yeah.
She's asking, when you do feel motion sick and you're getting over-the-counter medication for motion sickness, what does that do? That is basically shutting down the central nervous system response to hopefully let your brain adapt and your body adapt. So that's why she was saying, or did you say, I'm not sure, that certain medications you should not be on long term because you need your central nervous system to adapt. So that's a short term fix, if you will, but it's actually shutting down your central nervous system or that part of the brain that's handling. That's why you really shouldn't drive and, operate heavy machinery when you're on those medications, because your central nervous system reflexes can be impaired.
Yes.
Say, hypothetically, if someone was sticking a bobby pin in their ears.
Hypothetically, of course.
Hypothetically, asking for a friend.
No.
Do they reach those crystals, or is it further deep down in there?
Okay, that's a good question. So the inner ear, where those crystals live, are lodged deep in the skull. Not terribly far, but you'd have to bypass some very painful things to do that. I would be much more urgently worried about the eardrum. The ossicles, those three teeny tiny bones of the middle ear space, those can be fractured or broken. And by the time you do those things, you've got a whopping hearing loss and a medical emergency. And that's before you've even touched the inner ear, per se. So.
I'll tell her to stop that.
Yes.
Plus, is it a clean bobby pin, or are you sticking, that's been in your hair and stuff into your ear? I mean, you don't know what's floating around on these things. I mean, just hygiene-wise.
Yes.
So my question is about using earplugs on a continuous basis. So whenever I travel with my husband, then he gets up really early in the hotel room, and I want to sleep till like 7 or 8. And so I use the earplugs, and so after 3 days or so, my ears are sore. At least one of them is quite sore. Is it bad for your ears to use those?
I think it's not bad to use earplugs in the way that you're using them, but everybody's ears are a different shape and size. And sometimes something that's maybe made for a generic size of ear feels too big in your ear. One of the things that we do in our office is we make custom sleep plugs. So if that's something that you're interested in, we can talk to you about it. But we can take an actual impression or a cast of your ears, and we can get plugs that are made for specifically for sleeping or specifically for listening to loud music, or there are different kinds of things we can do like that. It may be more comfortable than those plugs.
Like a good idea. Actually, I noticed that one of my ears is always sore after I've used them for a few days, and I've also noticed that one of my ears just feels like it's constructed differently than the other ear.
They're usually not the same. You know how our faces are not perfectly symmetrical? Our ears are not either. They are usually a different shape and size.
Right, okay, so I thought it was just great when I bought my home, and there was two fireplaces downstairs and two upstairs, one in the bathroom and one in the master bedroom. And so now, like, I wanna wear earplugs every night because I can actually sleep and I don't have the noise of the chimney, but I can't. It's just, and I just realize it's ridiculous.
You also maybe, a lot of people move their jaws when they sleep.
That's it.
And that can change the shape, so when you put a plug in, it actually, you're moving, and so it's kind of rubbing, because that's what mine does. And it just rubs and it makes an ear sore, just from that, but it's probably not damaging unless you're wearing earplugs that totally are not meant for your ears.
Okay, I know I'm usurping all the time, but one final question. Sometimes when I, in the mornings, is usually when this happens, I just drink. I haven't eaten any food, or just drink something, and one of my ears will get stuffy. Is that an ear thing, or is that a digestive thing going on? Is that a breathing thing? What is it? I mean, it gets stopped up to where I can notice that there's a difference in the way I hear in one ear and from the other ear.
I have a guess as to what could be going on here, which is to say that there may be some struggles with the eustachian tube. Do you all know what that is? There's this little cartilaginous tube that connects to the middle ear space and then to the back of the throat. And when we yawn, or if you're on an airplane and you try to, like, what you're trying to do to alleviate that pressure is usually aerating that middle ear space. Well, if you're drinking a lot, it could be that it's just affecting that pressure in the ear space, and I don't know for sure, but maybe something you could try is after you're done drinking water, try something called the Valsalva maneuver, which is where you hold your nose and try to pop your ears.
Very gently.
Very gently. Yeah. See if that brings you some relief, because if so, then that may be what's going on. Yeah, like was said, no need to do any kind of high pressure anything, but you're just trying to gently aerate that space in the middle ear.
Do you have the same thing happen if you drink through a straw?
I don't think too strong, actually.
It'd be good for a good experiment.
And sometimes when you swallow, it kind of like,
opens
you know,
up,
like,
yeah.
Right.
when you're on a plane and you
Yeah,
swallow.
the eustachian
yeah.
tube will open and close when you swallow, when
Yeah.
you chew.
Yeah.
When you talk.
When you,
Yeah.
I keep a Bluetooth in my ear just all the time. Do that affect the hearing?
What I would want to make sure of is that the output on your Bluetooth device that it's connected to is set to a safe output level. My favorite is 85 decibels, so that you can't turn that sound up too high and damage your hearing with loud sound.
I had a question.
I'm curious about my grandchildren that wear earbuds all the time.
Uh-huh.
Is that creating a future problem?
Potentially, yes. There are more and more incidences of noise-induced hearing loss affecting young people, including teenagers. As mentioned briefly, you can set certain devices like Bluetooth headsets to a safe level. Not all of them, but many of them. 85 decibels is the number that is safe to listen to for 8 hours. When you go over that, even if you go over not by much, let's say you go up 5 decibels, which is just a little bit louder, well, now that time drops to 4 hours. You can only listen to that for 4 hours safely. You know, so the higher up you go.
And children should actually use it lower because of the shape of their ear canals. Once you get to adult length, probably teenager wise, then 85 is a good number, but if they're younger, you want that number to be lower.
And then is that 85 the right number for adults for 8 hours?
Well, it could be 80 to 85. You know, it depends on the studies. Some people at 85, it can cause noise damage. 85 is the safe level in general, the general level for adults.
What?
How do you measure that?
Yeah, how do you know
Okay.
what you're listening to?
So I know, for example, on my kids, they have like a little radio that's just for kids, and they can plug in a headset and listen to it at night. And I can actually go into the app that sort of is behind the scenes on that and set the level that I've decided is safe. The other thing you can do is, listen to it. If it's feeling like it's kind of loud, then it is. Just turn it and then back it off from there. If it's something that is loud and you can't adjust it and you can't set it to a safe level, then maybe we reconsider whether it's something we want to keep in the house. So this isn't just things like headsets, this is also toys. Like a lot of kids' toys are really, really loud. So it's not just annoying for us parents, and it is that. Kids are little and their ears are small and they're playing on the ground. So we have to be, cognizant. All that noise, it accrues over the lifespan. And so their hearing is tested a lot when they're little, but not so much when they're teenagers. So part of this is public education, audiologists getting out there and talking to young people about protecting their ears. And, anything to add?
Well, I was gonna say, you can Google it and put loudest toys of 2025, and you can find that, and it'll tell you, because they, I don't know who tests it, but there's some organization that tests toys. If you have children or grandchildren, you can look at that.
There are apps too on your phone that you can download that measure decibels.
Yes.
Yes, for the environment.
Yes.
Do you treat hyperacusis?
Hyperacusis requires some very specific management and counseling, and I personally don't have much experience, but I think any audiologist could get you started. If what you found was that routine course of treatment was not effective, then you could look for a hyperacusis specialist. But yes, that condition is, it just requires a lot of, every case is different. Like hearing loss, every case is different.
What is that?
Hyperacusis is a probably abnormal psychological reaction to sounds that are loud or that are perceived as loud. They may not actually be loud, but they are perceived that way. This can also be maladjustment to just sounds of daily living. So a good example is if you have a partner who chews and you can't stand the sound of it. So when that becomes something that impacts your quality of life, we're looking at the same kind of treatment for what we call hyperacusis. So yeah, it's about managing psychological reactions to sound. Yes?
If you're going to a concert where you expect it to be very loud, is there earplugs that you recommend so you can still hear but do the job?
Yes.
I use loops.
Yeah, loops are being marketed to parents. I see that.
Yeah.
So my favorite would be to use, if you know it's gonna be loud, foam earbuds, but circumaural muffs on top of it. So if you're gonna be in a situation that's very loud, those earmuffs that cover your ears, even though they don't look very cool, are gonna do the best job of protecting your hearing. And if you're doubling up on your hearing protection and using foam earbuds too, you're gonna be extra safe.
Do you want the music at all?
Well, it depends how close you are, and it depends on where you're seated. Are you sitting at the front?
Yeah.
Because, and I know there's also that sensation of you're so close to the loud sound that you can't even hear it well. There's just too much distortion that occurs in the auditory system. So sometimes hearing protection can actually help you enjoy the music.
Movies are so loud too.
There's also hearing protection that have filters in them, so like if you're a musician and we just need to drop the sound so you can still hear all the frequencies, because earplugs are going to drop those high frequencies. Those high frequencies are most damaging to your ear. But I wouldn't, like she was saying, I wouldn't necessarily recommend those at a loud concert. I would recommend the plugs.
Yes.
What is some of the latest technology involved with guys that like to hunt?
Oh yeah.
And hearing protection.
Yeah. What you can do is get custom made hearing protection that has a fast acting noise suppressor. So it is able to give you sound awareness and potentially help you hear in a very quiet situation. But as soon as loud sound enters the environment, it changes jobs and becomes very sophisticated hearing protection. And like anything, there are tiers to this. So there are hunters plugs and muffs that are less sophisticated, but they go all the way on up to really fancy.
Do you have Starkey products?
Starkey products. Our practice can work with any of the major manufacturers of hearing aids. Yes.
How do you test balance?
How do you test balance? Okay. So for as an audiologist, the kind of testing we do to evaluate balance, there's two, but I'm going to talk about something called VNG or ENG, but VNG is what you see a lot, which stands for video nystagmography. Big word. And what we do is we put goggles on you, and we are having you track dots, monitoring your eye movement. We're changing your position, and we're seeing if nystagmus is elicited. Nystagmus is that eye movement that's jerky. It's that like following the train motion that the eyes do. It can show us that you're dizzy. So we are looking at, is that a normal reaction to this stimulus? If we lean you back and you get dizzy, okay, now we know. And so by putting you in these different positions, we can figure out where in the vestibular system, or if it's the vestibular system that's contributing to your sense of imbalance. Then there's also a test audiologists can do. We do posturography, which is where we put you in some challenging physical trials and see how well you maintain your balance on a platform. So, and then we can do fun things like put you in a spinning chair. We do all sorts of fun things to check. But they're all looking at these different parts and pieces of the vestibular system to see what part is not reacting as it should or is having too big of a reaction to the test that we're putting you through. That's how audiologists can do it. That's what we can do, yeah.
When you need a knee replacement, how is that related to your balance?
So it's one of those systems, like remember the like nerves and the joints can contribute to our overall sense of proprioception, but it's also potentially weakening a limb. So, now you may have a little more trouble noticing where you are in space with that system. So it's really important to follow up with physical therapy so that you get that normal range of motion back and as much normal proprioception back as possible. Yes?
So what would be like the cost estimate for just a basic evaluation of hearing for a senior person?
Yes.
I mean, do we come in and can you give me some idea of what that would be like?
So how much would it cost to come in for a hearing evaluation? Now, we don't do balance evaluations at our office. There's some specialty places that do it. For instance, like UT Southwestern, they have a whole balance department and all that equipment. We test for hearing and we talk about tinnitus. It depends on your insurance, okay? So it depends on, we would check your insurance. Medicare will not cover it. That's an easy one. No, you have to have a medical condition going on that could cause hearing loss, and you have to be referred. Otherwise, we charge $200 for our consultation, which can be up to 2.5 hours. And that's all hands-on with the audiologist. But we're going to do all the testing, talk through your history, make sure you belong with us and not another physician.
Okay, thank you.
I took clindamycin and I noticed it was making my ears just really, really hurt and they were ringing really bad. And so I quit taking the medicine and I got a hearing monitor. And then when I went to see my general practitioner, he said, oh, you could have gone on taking that medicine. I was like, really?
Yeah, I mean, I think that in a perfect world with our physicians, they'd be able to really hold all of those quality of life things that we're experiencing when we take a medication. And, from the physician's point of view, it's possible that it was doing a good job of solving the problem it was prescribed to treat. But if it was causing other problems for you, you know, that's when you just get into these really tricky cost-benefit analyses.
And so, you know, my, jumping off of that, my question would be, is something like that happening, a good reason for a referral to get an ear exam?
So, well, there's almost two parts to that. She said there was a medication that she took that really caused her ears to kind of hurt and a lot of ringing in her ears. And she ended up taking a different medication, which was fine. But then her primary care said, oh, you could have completed the course for the first one. I somewhat disagree on that with the physician, because there are plenty of medications out there that can be switched, especially for your regular. Now, we talked some about chemotherapy, IV antibiotics. Those are kind of your life and death treatments, and so that's where you really have to work with the doctor, and you may end up with tinnitus. It's kind of like, well, do I want to die, or am I okay having tinnitus and some hearing loss and treating that a different way? Those kind of medications are different. Now, if that happens, do you come see the audiologist? First, talk to your physician to see if you can change to a different type of drug to fix the issue. Because sometimes those medications, like it did for you, if you stop one and go to a different one, the symptoms will go away. But if it continues after taking the medication and it doesn't go away, that's when you come see us for treatment of it. But if you're on a medication, like certain antibiotics will cause ringing. There are plenty of other antibiotics, so that might not cause ringing. Ringing is, I think there's like 498 drugs up to like 900 drugs that have ringing as a possible side effect. So it's very common.
So is generally the hearing loss permanent?
It depends. It really depends. For instance, aspirin in high doses can cause some temporary hearing loss and a lot of ringing. When you stop it, things usually get better. But things like the chemotherapy drugs, those IV antibiotics, those usually cause permanent issues, permanent hearing loss, and maybe permanent balance issues. But that like I said, those aren't common. Those are specific to that, but often, especially if you catch it early and you switch, the hearing will come back up. But there's some medications that don't, like Tepezza, which is for, thyroid eye disease. That can cause something permanent. But that's known. You know that up front because that is a known side effect of that medication. But a lot of them are temporary.
I have a whole presentation on that.
And audiologists will sometimes monitor patients who are going through these really aggressive medication protocols to see if after infusion there is a drop of hearing, so that you can more closely monitor those things. Thank you. Thank you.
Please get your gift bags on the way out, and if you would like to schedule an appointment with us, we have Melissa back there to talk to you. She's our director, so she can help with appointments and insurance questions. Thank you for It eliminates the risk of there are 45% dementia risk by things that we can modify in their life. The other is genetic, or they have it. Vision is one of those. And in the study, they showed that
gotta go to the grocery store.
Wear glasses.
I'm doing it on Wednesday at the Wiley Senior Center on the Equalizer.
Dementia risk due to vision is
Snatch
You
it.
still have to dementia risk from other things like hearing loss, diabetes. Obesity.
I couldn't hear, because I have.
Oh,
What did you say, that they were on, gender and something
I thought
else
I
for?
heard that it was a,
Thank you.
Thank you.
That's what someone in her family was taking for this, and they found some relief. There are other products that are marketed specifically for diabetes, and I think that know why this is happening.
Well, I wear hearing aids, and after I got hearing aids, I got this ringing in my ear. Yeah, but it's better when I come in.
Yeah.
It doesn't bother, but it's not ringing, it's just like a little red button on that.
Yeah.
So, I was just wondering.
It's possible that